Okay, so we try to answer as many questions that are frequently asked during the webinar presentation, and we want you to pay attention so we don't have to answer it in the Q&A session. The topics that we are covering today is pretty much obesity, its obesity risks, and we talk about what does weight loss surgery do, and we talk about MBC, Mexico Bariatric Center, and talk about our support programs. We will then turn into Dr. Osuna, which has not joined me yet, to explain all the bariatric procedures like laparoscopic, endoscopic. And we talk about financing, nutritional program that we have in Q&A session. Before this, I would release the Zoom poll, and then we do the raffle at the end. Make sure you have to be present, have answer the Zoom poll to be qualified for the raffle. Okay, so I just need to stop here, and in case you guys don't know me, my name is Elli. I am the founder and director of Mexico Bariatric Center and founder of Hospital Azar that we just started about 2 weeks ago. And Dr. Osuna is going to join us, but she hasn't yet, hopefully. Let me see if she texted me. Okay. No. Okay, so basically, we all know what obesity is, right? Obesity is a chronic, multifactorial, complex disease that continues to affect all countries, all nations, whether developed, underdeveloped, and US, Canada are not exception. And we are struggling with obesity as well. And there are so many, like we said, it's a multifactorial disease. So basically, throughout human history, calories were scarce, and our body is not used to all the inactivities that modern age living is bringing to us, and like ultra processed foods and sugary drinks. So in the medical field community, the measured obesity with the BMI, body mass index, is just the formula that we use or they use for plugging in your height and weight, and it gives you a number that categorizes you. Just a moment. Huh? I know, I didn't have time. Well, he can do it if he wants to. Okay, so sorry for that. Basically, if BMI number is more than 30, you are going to the obesity zone, and from there are different levels of obesity that they call it morbidly obese, super morbidly obese, super morbidly obese. The thing with our center is we have no limitation of what your BMI is. We can do a BMI of 110 or more. we have done it, and it's not an issue for us to handle all sorts of BMIs. We also in order to qualify, you need to have a BMI of more than 30. Sometimes if you're like at the 28, 29, depends on whether you're a Asian or you have some comorbidities, you can still qualify with our surgeons. But not every surgeon has the same criteria. That's why we have multiple surgeons. That's why we will see what we do for qualifying you for the surgery. So we talked about that, right? The increased nutrient content of food, the lack of physical activity, sedentary lifestyle that we have, comfort eating, stress, inadequate sleep, some of the drugs we take that causes this, and we are used to large meals. So when we gain weight, not only the fat cells or adipose tissues increase in numbers, they change structure. And a difference between a lean adipose tissue and an obese adipose tissue is really so obvious, as you see in this picture, that is causing all the comorbidities problem. Insensitivity to insulin, which is diabetes type 2, insensitivity to leptin, insensitivity to protein and exercise. That's another, what we call anabolic resistance. Basically, your muscles are becoming insensitive to exercise and protein. 2 is not responding to therapies or even vaccination. So these are the problems, right? So is a major risk factor, is impacting 40% of adults in US. I like to always show this animation. It's very simple, but it's very showing.
The diaphragm is one of the major muscles that helps with breathing. Breathe in and the diaphragm contracts and the lungs expand to take in oxygen. But if you're obese, fat in the abdomen can push on the diaphragm, limiting how much air you take in.
Okay, so, and we talked about all the side effects that comes with obesity, heart disease, cardiovascular disease, diabetes type 2, lung disease, impaired immune system, chronic inflammation. During COVID-19, it became obvious that we need to trim down and start a healthy lifestyle, because in case of obesity, there are more fat cells, and coronavirus likes to attach itself to the fat cells. More fat cells, that means you're more prone to catch this, end up in the hospital, end up in the ICU, and end up losing your life. Okay, so we all know what obesity is. I mean, I didn't have to explain, so now we know. Okay, so cure for obesity. Okay, so first is diet. Everyone tries that. Exercise, yes. But diet and exercise are not proven long-term solution for obesity alone. We'll see why. And I mean, we always have to be active. That's not, doesn't matter. But is not a proven system for obesity. And then, since the beginning of human history, we've been looking for a magic pill, or in this case, is an injection now, to magically lose the extra fat we have. And now we have Ozempic and Ozempic type of medication, drugs. We will talk about that. Those are also not a proven long-term solution for obesity, and we will see why. Then it becomes bariatrics, or weight loss surgery procedures, which is a proven, quick, safe, relatively safe, safer, and long-term solution. And this is what diet, our body resists against diet. And the reason is our metabolic system, right? Our metabolic system is basically the function of our brain interaction with our hormones, our gut hormones. And that's what determines our set point, or our metabolic point, or brain thermostat, however you want to call it. So our brain and hormones are operating at a certain set point. And let's say if I weigh 250, like this guy in the red, and I have 75 pounds extra weight to get to my ideal weight or goal weight, and I do extreme diet and boot camp type of exercise, right? And I lose 75 pounds. When I'm during this process, my body is trying to resist it by taking me back to where I'm used to operate. So as a result, I'm going to be more hungry and my metabolism goes down. Now, bariatric surgery, however, because it changes your hormones and it gives you the anatomical changes, right away after the surgery, your brain, your gut hormones, all your hormones are going to operate at 175 pounds. The minute you wake up, you have those changes built into you. So now your hunger is going to go down, opposite of what happened with diet and exercise. And the metabolism goes up, which means you're going to burn fat. That's the difference between diet and exercise and bariatric surgery. So bariatric surgery is like magic, right? Once you get it, it resets your metabolic system. That's the difference. It resets your metabolic set point. So from the way that bariatric surgery works, the scientist, the pharmaceutical, got the idea of making Ozempic. As you see on the right side of my screen, these are the hormones, known hormones, that are changed after bariatric and, well, they actually call them bariatric and metabolic procedures. I mean, we always say bariatric surgery, but really is bariatric and metabolic surgery because it changes your metabolic set point. So look at the hormones that are changed. Ghrelin, CCK, the GLP-1 is what Ozempic is. So Ozempic is is synthetic hormone. Okay, is a synthetic hormone that emulates or trying to mimic one of the effects of bariatric and metabolic surgery. So GLP-1, GIP, now Mounjaro has GLP-1 and GIP. So those two. Ozempic only has GLP-1. Mounjaro has GIP, and then look at all the other ones, PYY. I mean, look at the leptin. So the idea is that there are so many hormones involved in the bariatric surgery, and that's how you get the metabolic reset. And Ozempic, now there are some side effects. It could be long-term effects. They don't know. They're already saying you may get irreversible vision loss, could be cancer, anything. But you lose weight, not as much, but you have to keep taking it. That doesn't work. First of all, it's financially expensive and is not a long-term solution. That's why we said it's not a long-term solution. With the bariatric surgery, you get long. Now, that's being said, so this pyramid puts everything into perspective, right? Diet and exercise works for a very small portion of the population. And then it's the semaglutide injections like Mounjaro, Wegovy, Ozempic. Those, again, work for a small portion of the population, not for everyone. And then it's the endoscopic procedures that they push, like gastric balloon, endosleeve, ESG. And then comes the gold standard, which is bariatric surgery, which is gastric sleeve, bypass, duodenal switch, all that. Bariatric surgery is actually an expensive procedure because it's involved material that are expensive. And then you need hospitalization, which in the US, they're trying to make it to be an outpatient, which is like, you really need to be in the hospital, be observed. And we don't cut corners on that. We keep you enough time to recover. So if you don't have insurance, or you have insurance, your insurance doesn't have obesity treatment, surgical intervention, or your deductibles or the rules to qualify doesn't really, it's not easy, then you look into medical tourism, which going somewhere else to get the procedure. So Mexico, it has made itself a location, a center for bariatrics and plastics too. And they have the best surgeons, they have the best facilities. Of course, depends on who you go with, but again, we go over that. So now it's time to look for medical tourism. First of all, you have to consider to work with a coordination company like NBC, because we basically offering peace of mind for you and the security of where you get your surgery done and who you get your surgery done. We do all the transportation, hotel reservation, so you don't have to worry about a thing. I just came back yesterday from our Hospital Azar, and I talked to quite a bit of patients. One thing I heard was they kept saying, you guys exceeded our expectations. And it was interesting to hear that several people mentioned the same thing. So MBC, Mexico Bariatric Center, we are a US-based corporation facilitator. Our main office is in Sacramento. That's where I am right now. In actually Folsom, California, Sacramento area. And since inception, our commitment has been to patients to offer highest quality, with the lowest possible prices. And actually, that's another thing we hear from the patients, saying, why you guys are so inexpensive? We are the leader in the industry. We've had 12 years in medical tourism with MBC. I started being in this industry actually in 2007. So that puts me 17 years of experience, and MBC that I started in 2012 has 14 years. 12 years of experience in MBC. We have performed more than 25,000 successful procedures. And these are just not, we're just not throwing numbers. We have a list. Since we started offering these numbers or advertising these numbers in public, every company, every surgeon, standalone surgeon is trying to say they've done the same thing. And we know some of them. Statistically, it's impossible for them to perform what they are claiming that they have performed. So be careful. We could give you the list of 25,000 plus patients. We're not just saying, okay? So this is what you're getting with this company. And right now we're working with the top 5 bariatric surgeons in Mexico. So here's another thing. These are standalone teams. Some companies offering like, oh, we have 5 or 3 surgeons. They're just really one team. These are 5 separate, independently operating teams, which means there is a main surgeon, lead surgeon, assistant surgeon, instrumentation, nurse, technician. Every team has its own, basically, people that work as an independent group. So remember that. So many reasons to choose MBC. If you compare our prices and what we offer with other providers, it would not take you a minute to make a decision to go with us. And something I want to make you aware of is these new upcoming assistant surgeons. A lot of the surgeons came from other parts of Mexico to Tijuana because the business was good, right? But they don't have experience. They all got trained as a bariatric surgeon. They went through courses to get surgery. Actually, it's funny because our surgeons are training people from Mexico and South America, like Chile and Peru and all that places come and get training from us. But they put a website together and they claim they've done so many surgeries, but really they have no experience or very little experience. And I always compare surgeons with the pilots. You don't want to fly with an inexperienced pilot because most of the time the flight goes okay, but there is that one time that they don't have experience how to deal with it. And it jeopardizes your life. So it's a risky proposition to go with a company with an inexperienced surgeon that they're claiming they have done all that and they know all that, but they really don't. Well, that's what MBC offers. We offer experienced surgeons. The least experienced surgeon we have done 5,000 procedures. So just add it up. Okay, so we talked about why MBC. Here's why MBC, right? Our reviews. Just do your research, okay? Do your research. We'll see our process to qualify your health questionnaire, how we go about it. The spectrum of procedures we offer, that's another thing that we will go over. And let me just take a moment here. Okay. Okay.
This meeting is being recorded.
Oh, yeah. Okay. All right, so let's go back to our slideshow. Again, a lot of companies put up a website. Actually, they all imitate our website most of the time. They put some before after picture in. They get actually these marketing companies, the day and night, they're putting stuff on Instagram and TikTok and Facebook, and they are slamming and spamming these channels to get patients. And patients they'll look at, oh, they look so nice, and they think that there is really nothing behind these companies. First of all, you don't know who is running them. I've been present, my face has been out there. We've been going to seminars before COVID to all locations in US and Canada, from Texas to Washington to Calgary and Edmonton, name it. We've been all over the place with our surgeons, educating people, telling them about what is this that we offer in Mexico. And, you know, they know who is good or bad. They know who's running the company. But these people don't know, you don't know. Okay, I guess. Okay, so now it comes down to what we did recently. Well, it's not recent. I started this project of Hospital Azar in 2021 after looking for a place to have a hospital, finalize it in 2021. And it took us about 3 years to build this state-of-the-art center that you guys are going to see once you go down there and see how well is designed and how well is equipped.
They don't know the things that that's what we say. 16th of September, lying in my bed, I'll wait forever. It's never too late. Couple thousand miles, it's just a little space.
Yeah, this basically project Hospital Azar, we started 2021. And the name is coming, basically, Azar is my mother's name and is a tribute to my mom's memory and her faith, integrity, and inspiration that she gave my family. And basically, she was actually FaceTime with me when we did the grand opening 2 weeks ago, and she passed only a few days after. So she witnessed this surgery center open. And basically, you will see, these are not just pictures, you will see the quality, the detail, paying attention to detail, the technology we've used in this hospital. It's basically 3 floors of hospital beds, operating rooms, 4 operating rooms, about 40 beds, in a very prominent area of Tijuana, one of the best areas, and you will see, you have a 360 view of the whole Tijuana, basically, looking everywhere. And again, like I said, the technology we've used is the best of the best, is the most advanced equipment in there. And we just started Wednesday of not last week, the week before, and already patients are bragging about the center. I was there a few days, I just got back, and everyone is happy, from patients to staff to surgical staff to doctors, nurses. Everybody loves this place. It's beautiful, it's comfortable. You see, you have view of Tijuana, and it's really a refreshing experience. Now we talk about how do we qualify to get this procedure. Very simple. You fill out a health questionnaire, you choose a date that is available. Once you get your approval, you can even make your booking yourself by going to MexicoBariatricCenter.com. It's called Book Yourself Surgery. You pay the deposit, you are on the calendar, you basically finish your paperwork, your flight information, all that. If you're flying or driving, you would know. And that's all it takes. And you just show up. We do the rest. You be on the losing bench. Our packages are all inclusive, like I mentioned. Everything is included. Of course, we have everything as a standard package. Anything extra, you have to pay. Like if they find a hernia repair, you just have to pay extra, like $395 or things like that. The BMI is extra. So, but as you see, we keep you enough nights in the in the hospital, so we don't compromise your safety, your well-being. As far as support, we have several groups. Our main group of our past patients have over 13,000 patients. You get to interact, share before after pictures, see their progress, see their challenges, and help you with your journey. That's what you get with us. We have surgeons Q&A, We have coordinators live. We have nutritional webinars. You have these webinars that I'm doing. So there's so many places that you can get support and information. So this is a list of our past patients that are helping us day in, day out. Of course, we just had another past patient, Yvette, to join us, so her picture is not here. Sarita and Rena do a live podcast, and that I suggest you guys watch periodically. It's really informative. Again, I noticed some people joined after the first time I mentioned about a raffle. So I'm going to go over that again. So if you have not filled out a health questionnaire, please do that. If you do have one in our system, you don't need to resubmit one. At one point before Q&A session, I will release the Zoom poll, and then I need you to fill that out, complete that, and then watch the webinar to the end so you can see who is the winner, and we would have that winner announced at the end. We were talking about experienced, inexperienced surgeon, about the team of surgeons. These are 5 teams. Surgical teams. Each team has its own staff. It's not like, oh, they just work together. They don't work together. They're working in a team, helping each other, supporting each other, but they're not the same team. Dr. Miguel Montalvo, Alejandro Gutierrez, our chief surgeon, Rodriguez Lopez, Dr. Jacqueline Osuna, that she was supposed to be present in this webinar, but honestly, I don't know what happened. Let me see if I hear, oh, okay. Okay, so she's gonna join us hopefully soon. Okay. Make sure we send the link to her. Sorry for delay. I'm trying to get her online so she can help us. So this is another plus that you won't see anywhere else, I promise you. When the patient submits the health questionnaire, it goes through the surgeon liaison. She's a doctor that is American doctor that was educated in Guadalajara, is one of the best universities in Guadalajara for Americans, and she's bilingual. She's been with us for over 8 years doing this. Imagine the expertise we have in-house. That surgeon liaison, first of all, we have complex algorithms that connects, first of all, you with the best surgeon that matches you. Most of the time, let's say if you are a gastric sleeve, BMI of 40 is not an issue, but when you get to these specific requirements, specific patients, then we are going to match you with whoever is the best for you. And the surgeon liaison makes sure that HQ gets handled the right way. It will give you the list of medications, things that you're not supposed to take or stop taking before surgery. And that's how we operate. This is one of the reasons we are so successful. We use Hyatt and Pueblo Amigo for our hotel. By the way, Hyatt has a very good breakfast for your companion. Companion stays in the hotel while you go to the hospital. They have visitation time from 10 to 12 and 5 to 7. They are basically from our building, from our facilities, you can see Hyatt. That's how close we are. We're about 3 blocks walking distance. And our pre-op diet is basically nothing but sorry, I'm trying to. So our pre-op diet is very straightforward. It goes by the BMI. If your BMI is low, you just have to do the 2-day clear liquid. And if I'm so sorry, I'm trying to get Dr. Osuna to join us. She was in surgery, that's why she is a little delayed. I apologize for that. Basically, your BMI and pre-op diet is really a way to shrink your liver, make things easier for you and the surgeon during the surgery and recovery. So the best you can do the best you can do. And that's just, just be mindful of carbs, drink, protein shake, just salad, fish with chicken, things like that. Just do the best you can again. For medications, I mentioned, you get a note about if you're taking medications on a regular basis, which one to stop, which one not to take before and after, and how long. Again, please, no Advil, NSAIDs, ibuprofen at least a week before. Smoking is huge. Please stop before and after as much as you can. And people who are on Ozempic and semaglutide type of medications, you need to stop at least 2-3 weeks before surgery. So whether you fly or drive to San Diego, our driver meets you at the San Diego International Airport. Terminal 1 is going through some modifications, some renovations. So it's a little mess, but so many like Delta, American, all those United come to Terminal 2. Southwest is the only one coming to Terminal 1. But they are promising 25 to be the time that is going to be ready to go. So that should be exciting. In general, San Diego International Airport is very beautiful, located by the water and marina. We do have special rates for Hampton Inn for patients that are patients. If you mention our name, they will give you a special rate. And if your flight doesn't match, to arrive, we want you to arrive before noon and leave after 2 p.m. If your flights don't match this, you have option to stay whether in Mexico or stay in San Diego. So you can book with Hampton Inn or with us in Mexico. So when you arrive, we do all the tests. We take you back to hotel. Now we're going to actually giving option to people who are coming by themselves and they would rather stay in the hospital and not go back to hotel during hospital. You can ask your coordinator about that. So that's an option we're going to start offering. So that way you go to the hospital, they do the pre-op, you stay in your room, the next day they take you the surgery so you don't have to go back and forth. I think this would really work for people without companion. It's less packing, unpacking, going, and believe me, the hospital is so beautiful. It's better than hotels because you get glass windows. When I was there, I was going to people's patients' rooms and they were just amazed by the view. It just gives you that serenity and it really helps you heal. On the day of surgery, we pick you up, we take you to hospital, and we get you ready for the surgery. You stay there. Actually, this is the picture of our patients in the new hospital. These are one of the first ones you see. So that's in the lobby, in the reception area. So you stay there 2 or 3 nights. Well, 1 night for balloon, 2 nights for sleeve, 3 nighs for bypass and DS. We do all the leak tests, all the post-op tests, pre-op tests, everything. You're ready to go. Well, again, if you need to stay extra night, whether you're flying or driving long distance, just one moment. I'm so sorry for this. Yeah. And now you can drive or fly back home. If you're flying long distance, make sure you walk around often. Just get up and move around. Make sure you have compression socks, all that. Another reason we are so successful because we manage our surgeons' loads on a daily basis. We basically cap them based on the complexity of each procedure to 3 to 4 surgeries per day. And our complication rates are less than 1%. Published data shows 2.8%. And these are like little things, maybe the incision infection, little things like that, nothing that is life-threatening. But again, you need to do the pre-op right. You need to do the post-op right. You need to comply with what you say. So I'm going to talk about Dr. Jacqueline Osuna. That hopefully she will join us. Again, she had a surgery and now she's delayed. I'm so sorry for that. She actually, I know her from way back in 2010 when I met her and her husband back then, Dr. Lopez, in Guadalajara. And she's a prominent surgeon that's specialized in bariatrics. She works with one of the best hospitals in Guadalajara. Again, she has plenty of experience. She works in Guadalajara as well as Tijuana. So she's here in Tijuana with us 1 week and she goes back to Guadalajara. Okay, so I usually this is the part that Dr. Osuna is supposed to cover, but I will cover it until she joins us, hopefully soon. Our center is not offering just gastric sleeve for patients BMI of 30 to 45. That's something we need to pay attention. It's very important because we give you all the options from laparoscopic, endoscopic, and hopefully soon robotics. We're working on that. So look at the variety of options. So for us, won't matter what procedure you choose or you receive, we want the best option for you. And that's what we're working toward. We're working toward giving you the best option, best possible facility. And of course, gastric band is outdated, but look at gastric sleeve, mini sleeve, single incision gastric sleeve. Those are for BMI, lower BMI. RMY gastric bypass, mini bypass, duodenal switch, which is BPD DS, which is conventional, traditional DS. And then there is a variation of that, which is single anastomosis DS, SADI, we call them SADI. A lot of different revisional surgeries. Actually, we just had a webinar last week about, for the first time, about revisional surgeries. And people were amazed by the type of revisions and reversals that we can perform. They told us we never knew there are so many options. Again, we do mini, for example, we can do mini bypass to bypass revision. We can do so many different revisions. And then it comes to endoscopic procedures, which I mentioned before, is basically gastric balloon and endoscopic sleeve gastrectomy, which we call ASG or endosleeve. And we do revision of a bypass for the pouch endoscopically, which we call TOR, which we call endoscopic bypass revision. So if your bypass is not working because you stretch the stoma, we can shrink that endoscopically without a surgery. So you just go through the mouth, down to the pouch, and stitch it. That actually can help with your dumping syndrome too. So these are the so many options that you see that we are offering. I don't think that there is any center or company that can offer you all these in one place. And that's what's important, because if you get, okay, so I have seen this patients that in other centers, whether sometimes they qualify for a surgery, and then once they show up down there, they say, oh, that's not good for you. Let me give you another option. But really, it's your internal guts and in your internal organs that they're messing around with. So one case that I've seen is they can't do a BMI of more than 45 for bypass, for example, because they don't have the expertise or the skill to do it, right? So what they do is, if your BMI, let's say, is 55 and you really need bypass, they convince you to get sleep because they say, well, bypass is not good for you. But really, you need to get bypass. So this is what happens. So you're getting the wrong surgery. And then end up with consequences. So here was another statistics that we presented in the revisional webinar. In the literature, it shows more than 15% of patients need a revision or reversal due to insufficient weight loss or weight regain or side effects complications from the first surgery. You know what that stat is for us? Less than 5%. We talked about our complication rates is less than 1%. Published data is 2.8 and more. Same thing is happening to our revisional surgery. Our patients need less revision. Is the type, so it depends on so many different, you have to get the right procedure. The surgeon that performs that procedure is huge. Do you think all the surgeons perform the gastric sleeve the same? No. It's just called gastric sleeve, but they have their own technique that they have developed over 4, 5, 6,000 procedures to know how much to cut, where to cut, to make the best outcome, the least amount of complications. So these are the things that I usually don't say in the webinars, but this time I'm taking my time to explain. There's so much into this. So it is absolutely I want to say it is this is your life, basically, we're talking about, right? This is your well-being. So these companies go and try to advertise for low cost, do all the Instagram stuff to show that they're good, but really you have to look under the hood. And it's your life. Please be aware of what is involved and what you're getting for what. They made it like this is a medical procedure. It's not like we're buying t-shirt, but unfortunately the business has become like a t-shirt. This one advertises $100 less to get more patients. But with $200 less or more, what is it that you're getting? That's a question you need to ask. What I'm going to do is I'm going to let Dr. Osuna hopefully join us and talk about all these different surgeries. And what I'm going to do is I'm going to cover the rest of the slide until hopefully she joins us. Okay, so COVID is doing a comeback. Please test before you come. Test yourself, companion. Make sure you don't bring COVID to people around you. We don't enforce vaccination. As far as financing, you have several options. We have it on our website. Super Money is one. Super Money is working with a bunch of other companies like Bank of America, SoFi. And these are basically, you know, if you have a good relationship with your credit union, those are places to go also. Make sure you don't apply for too many places at one time because it would probably affect your credit score. Why NBC? We offer through the third party, of course, a medical tourism insurance, complication insurance, which we call MTI, that we offer at a very low cost. It's only $179. And again, we were able to negotiate this price from $400 to this for our patients only. It covers 45 days out after your surgery. From the time you actually travel, you covered until 45 days for any complication from the surgery. That is huge. Please make sure you take advantage of this offer we do. Our nutritional program is complete. Christian is doing a great job doing webinars, talking to patients, making sure they're doing a good job on pre-op and post-op. He's working on what we call Nutrition Plus program that it would cover even more support for you guys. He should be coming out with the details soon. Again, you know, we even have our own bariatric vitamins that we call Emerge. It comes in, well, this is what I was talking to you about, the MVC Nutrition Support Plus. It will be announced soon. This is what you get with that program. And our vitamins come in different forms of soft, chewable, drinkable, capsule. Try, see what works for you. And this is very important to keep with these vitamins because these are made based on ASMBS requirements and standards and recommendations with the best ingredient to give you what you need as a post-bariatric patient. For gastric sleeve, we recommend to take this at least the first 2 years. For bypass, pretty much 5 years and more. And DS, indefinitely. Here's the thing. You lose weight. There's going to be a honeymoon period that you lose weight. But remember, you are in this for long-term success. And long-term success is not only defined by losing weight, it's defined by how well you do as a whole. So you don't want to have any bone density problem. You don't want to have any nerve system problem. This will not show up right away, but it will show up 8, 10 years out. So you're trying to acquire a tool to help you to get rid of your extra fat, take care of your comorbidities, which it does, add extra years to your life, once forever. But you have to, well, like I mentioned, you have to do the right steps, do the right pre-op, comply with the pre-op, comply with the post-op. Post-op is basically a 4-week transition from liquid to solid. Don't lift heavy weight. Even when you're going back, you know, even when you are in the plane, maybe have somebody help you put your suitcase up in the cabins. If you are taking your, first of all, because Tijuana is right next to San Diego. So if you haven't been there, they are not having these extreme weather changes. So you don't need to pack 2 suitcases. Just pack light. First of all, it's good for you because you're not lifting heavy weight from here to there. And just on the flight back, if you don't check in your suitcase, for example, make sure somebody helps you to put it on the upper you know, so you don't stretch too much or you don't, you know. So these are the things you need to be mindful of. So I'm going to actually release the Zoom poll like I mentioned. It has 5 questions and I released it. Please go ahead and answer these while we're waiting. Meanwhile, I'm gonna go. Actually something. Okay, so we need to event. Okay, so there we go. Let's go over some of these questions that people ask. They're asking about reinforced gastric sleeve. So let's go back to that. Let's go back to that slide that shows gastric sleeve. There you go. So as you see, the surgeon puts a boogie or bougie down from your throat so they can cut around it. They cut pretty much about 85% of the stomach. And they have a tool that cuts and staples 3 rows at the same time. As you see on the picture on the right side, you see the staples. Now, our surgeons also reinforce this with stitches over the staple line, which we call reinforced. It comes as default, all of our surgeons do. So we actually performing reinforced gastric sleeve with sutures. Okay, so that's a question for you, Anna. If you have performed abdominoplasty, like a plastic surgery, it's not interfering with the bariatrics most of the time. So you don't have to worry. People who have diabetes type 2 usually get full healing or at least good results, so they need less insulin. So the gastric sleeve side effects are pretty much could be acid reflux, and that's again in 10% of the time. 10% of the patients experience acid reflux. But if you choose the right surgery, let's say if you needed RNY and you didn't get that because the surgeon couldn't do it. That's the problem. Because then you end up with having, but only 10% of gastric sleeve patients experience reflux, acid reflux. Um, you know, that's pretty much it. You know, gastric sleeve doesn't have very many side effects. It's a very good surgery, but again, you have to get what is best for you. Okay, so in general, you want to wait 1.5 years to get pregnant. Um, and here's the thing, once you start losing weight, if you had problem getting pregnant before that, now you have more of a chance of getting pregnant. So almost everybody answered let's go. Everybody answered the Zoom poll. Just waiting a little bit more. So let's go on. Okay, so these are our surgeons are Mexican board certified as a general surgeon, and some of them are double board certified for bariatrics as well. Now, about so, but they are some of them are a member of ASMBS and FACS in the United States. They're a member of. One of our surgeons recently got invited to the American ASMBS assembly to actually teach to the other surgeons in a course for SADI. So this is the qualification of our surgeons. Yes, so what we do for the leak test is we have an X-ray machine or X-ray suite inside the hospital. We take you there the day after. Actually, I have a picture of this last time. Let me see. So I think she's training. Okay, so I wish I could. So it's funny, this picture I want to show you. I don't know if you see, but this is yesterday. Oh no, yeah, maybe 2 days ago. So you all come down with your IVs and you wait in the lobby to go to the X-ray fluoroscopy. That's what happens. So in an ideal case, you need 3 nights for the sleep, 4 nights for bypass and DS. So the first night you stay in hotel, 2 nights in the hospital, go back home. Again, if you want to stay extra. Thank you, Hannah. We are privileged to have you too. Okay, if your flight is delayed, because we see that sometimes, this during the hurricane, some of the flights were missed around, we would still try to catch you, take you there, accommodate you. So in San Diego, the pickup is in actually San Diego International Airport, like I mentioned. Now, back to the pregnancy question. If you receive endosleeve, you may not have as a strict requirement to get pregnant. You still want to make sure you become, we say that to patients to be eligible for plastics also. We say wait 1.5 years because you want to get to your weight, ideal weight, and goal weight. That's the best. In case of ESG, you may not have that. It's a good idea, but you may not want to. It's not a big deal to wait 1.5 years, I think. We can run it by our surgeon, make sure my answer is correct. Okay, so David, the best revision, first of all, when you guys do the health questionnaire, you can ask the surgeon, what is the best option for me? Because they would answer you. So I wish I had the chart from our past revisional surgery webinar to show the amount of weight you lose after, let's say if you had band. Usually band, their option is to go to bypass or DS. But you can still try sleeve too. So you know what? I would ask Dr. Osuna about how long after ESG you can get pregnant. Let me actually ask one of the surgeons, see if we can get that answer done. Just give me a moment, please. How long do you need to How long do you need to wait to get pregnant after ESG? Okay. Hopefully we will have that answer. We do try to advertise for Guadalajara, but maybe not as much as Tijuana because we get most of our patients in Tijuana. Okay, so they call them from A to Z, from the time you walk into the surgery area, by the time you are in the recovery, it's about 1.5 hours. The surgery for sleeve is about 30 to 45 minutes itself, right? The rest is preparation. For bypass is about end to end is 2.5 hours. And the surgery itself is about 1 hour, more or less. Now they're asking, how much do I need? What surgery do I need to do to lose 40 pounds? Remember, this is the tool you're acquiring. And actually, I wish I had that formula. There's a formula that you can plug into things. So let me see. So basically, everyone, man and woman, based on your build, you have an ideal or goal weight. And you have a starting weight, which is right now, right? And you want to get to your goal weight, which is here. And then there is a formula to say, okay, gastric sleeve, for example, in average, you lose 65% of your extra weight. But that's just the average, doesn't mean that you lose that much. Some people actually lose 100% of their extra weight. But that's a formula you can kind of get an idea of, like, so that's why you determine when you say you need to lose 40 pounds, is like how much of your body weight is 40 pounds. Okay, so as far as complication, they categorize complication as two categories. One is the short-term complication, one is a long-term complication. As far as short-term, it's something that we take care of while you are down there under our supervision. When in long-term is after you go home. Again, if you comply with the diet, not lift heavy weight, things like that, you should be okay. But if you do experience complication, you need to go immediately to emergency or to a doctor. That's very important. You can always call us and we'll tell you. But again, it's not something you can wait to go back to Tijuana to fix, okay? So. The boogie of the surgeon use is usually about 34. Every surgeon is a little different, but the average is 34 boogie. But it's really the technique of the surgeon. Yeah, it doesn't matter, Megan. You can qualify for the raffle as long as Dr. Osuna can qualify you. Yeah, we would send you all the information you need for pre-op and post-op. Again, we do webinars. There's a nutritionist on our staff here. You can call, text, email. Yes. If you have submitted a health questionnaire before and you're in our system, you don't need to resubmit it. Yes. Yes. Haley is asking, Haley Fuller, that do you recommend sleep for someone that has lost weight, but it's hard to maintain? Yes, that's the whole idea. And the sooner, the younger you get the surgery, the better it is. You change the remaining of your life and you improve the quality of your life sooner. So there is a when you get the surgery, especially let's say gastric sleeve, you are getting a new stomach, right? You may actually start not liking certain food or liking another food, not like before, because the things are changed. Well, you're not gonna lose the taste of food. You may just, I hear some people like, they don't like eggs after the surgery or something else. But that's just changes because it changes in the stomach and your hormones. but you shouldn't vomit or lose taste of food. Okay, talking about the healing process, usually the surgeon goes over that, but I'm going to go over it myself. There is a chart here that shows what type of surgery you get and what to expect. Okay, so as you see, if you're doing office work, gastric sleeve 1 to 2 weeks. Again, you have to listen to your body. Just don't make yourself exhausted. You can still walk, move around, you know, but if you're doing heavy lifting at work, you need to take at least 4 weeks out. Now we're talking about also some people ask, when can I go to gym and lift heavy weight? You want to wait at least maybe 8 weeks. So no heavy lifting 6 to 8 weeks out. So that's the healing process. Okay, so let's talk about ESG a little bit. We talked about, you remember the pyramid? We said, okay, so many patients, so many % of the population do well with diet and exercise and so on and so forth, some with Ozempic. Now you come to endoscopic procedure. Basically, endoscopic gastric sleeve, which is ESG, they go endoscopically and they stitch your stomach and make it smaller. So it gives you the restriction, which is good for food intake control, right? So it's imitating gastric sleeve restriction, but what it doesn't give you is the hormonal change, right? This is really reserved for patients who are maybe 35 BMI, maybe maximum 40 BMI. You can qualify for this even with the BMI of 27, 28. That's the beauty of it. And it has to do a lot with your discipline and how you start eating or developing healthy eating and active life. So just again, this is a tool you can work with as long as you work with the tool. I hope I answered that, Marilyn. So yeah, I mean, I shared some of the rooms inside of the rooms in the new hospital. Actually, let's see. Okay, so that's back. So for the pregnancy question, if you receive ESG, you have to wait 1 year to get pregnant. But for everything else, for sleep or the laparoscopic procedure is 1.5. Okay, so let me see. So this is like this is I just videotaped this when I was there. Dr. Gutierrez was talking to one of the patients. This is one of the rooms. But pretty much every room is the same. Like this is another room we were videotaping. yeah, so um, this is one of the, so I took some pictures of the patients here. This is what the inside of the room looked like. That's the nurse station. This is like some of the 2 bedrooms. These two came as buddies. Pretty much all the rooms look like that. Okay, so yes, talking about the fees. So when I showed you in the slide that shows our regular prices, if you have revisional fees, like let's say if you're converting your bypass to bypass or sleeve to bypass or sleeve to DS or band to sleeve, these have additional revisional fees because not only the surgeon has to deal with the scar tissues from the first time, sometimes we have to do endoscopy to make sure everything is good down there. So that's why it's extra fees. For high BMI, more than 49 is extra fees. So, but we're disclosing all that in our websites and in here. Again, I mean, gastric sleeve offers really good solution for weight loss. But again, if you go over here, I show you um, what's the criteria to choose the sleeve versus bypass, right? So usually bypass is for higher BMIs. If the scar tissues are so bad that they can't perform the surgery, then they have to go with sleeve. If you have acid reflux, you go with bypass. If you have had previous ulcer, you go there. If you have slower metabolism, you go with bypass. If you have sweet tooth, you go with bypass. So there is criteria to which one is what, right? So that's why you ask the surgeon. That's why you consult with them before the surgery. And they would guide you to the right place. The difference between mini bypass and bypass. Again, see, there are criteria how to choose which one over what. Yeah, so we mentioned about visiting times for the companion is between 10 to 12 and 5 to 7. Do you need a passport? We highly recommend to bring a passport. When you cross back to US, it may create a problem. So the staples I mentioned, and that they're used to cut and staple your stomach shut, they are titanium and they stay there forever. Well, I want to appreciate you guys for all the thank you notes that you're putting for me. I really appreciate that. We're here to serve you. We've been here to serve you for a long time. Yeah, if you buy the MTI, which I mentioned, the medical tourism insurance, that's covered when you come back to US as well. Yes, we do. We did have the meal card. I don't know if they're still giving you, but you can ask for the meal card from us. We help you with FMLA as well. So if you need FMLA, you can ask us to get it. Over 55% of our patients come alone, so they don't really need a companion. It's just a matter of whether you feel like bringing somebody with you. So they're asking, what are the options available for an RMY bypass that was done 20 years ago and gained 100 pounds? Remember, the revisional surgeries are always more complicated, more risk, and it may not result the same amount of weight you lost last time. However, depends when we talk about 20 years ago, not all the bypass surgeries were done the same. That's why you need the expertise of our company. But they can go in there and do the best for you. But we cannot promise if you can lose 100 pounds or not. We cannot guarantee, but we're willing to work with our surgeons to go in there, see what they can do. Sometimes the bypasses were done so different, and these surgeons know how to deal with it. Usually bypass is better than sleep because you get that malabsorption component. With sleep, you get the hormonal change, you get the restriction. But with the bypass, you get restriction, hormonal change, and the malabsorption. So people who get sleep, they need to work harder after the first 2 years to maintain in general. But that doesn't mean applies to everyone. You know, guys, I've never got this many compliments in any of the webinars. I really appreciate all the comments you're making. Even though we missed Dr. Osuna, which I'm surprised because it must have been something that she never joined us. Okay, some of the questions that you're asking, if it's too technical and medically involved, I would not answer it, but that doesn't mean that you can circle back and ask our staff here. You can call us, email us, text us, and we will be more than happy to answer any of these questions. Yeah, duodenal switch is a complex surgery. It has more nutritional, what would I say, side effects. You have to really watch for malnutrition. However, I was reading a recent research published that 15 years out, DS duodenal switch had the best results. So you have to remember that. You know, again, It's a tool you acquire and you have to work with that. But I wish we had some of the slides. We just did a revisional webinar last week, last Saturday. Again, we're going to do more. So if you need more of the revision. So in general, you lose weight and you never go back to your original weight. Almost always. You may not lose enough or weight regain. You know, there are things happen in life, right? Divorce, loss of your loved ones, all these things that happen in life that may be a setback for your weight loss or regain. But you still have your tool. You can go back and use it, do what we call 5-day, 10-day pouch reset, all that stuff. We have that nutritional program coming that you can get support to lose more weight. But if you don't, let's say with the sleeve, you can always go to bypass and mini bypass, and that does it. We've seen that numerous times. So we charge, so sorry. We charge extra charge for companion. That covers everything. There are transportation, hotel stay. I think for sleeve is $245, and for bypass it's like $295. But that covers the hotel stay, transportation, everything. So you don't have to pay extra. We make the reservation for them. They don't have to worry about anything. So based on the health questionnaire you provide, we give you recommendation, we book what you think it's best for you, and you get on the calendar, let's say for sleeve or bypass. You still have another chance to talk to the surgeon before your surgery. Make sure that is the best option for you. They're asking me, let's say if I'm signing up if I'm signing up for ESG, can I still change my mind? Yes, to the last minute, you can change your mind. We just adjust the difference between the prices. Okay, so I think we are almost approaching 2 hours, and I want to thank you, everybody. I am so sorry. I want to apologize. Dr. Osuna couldn't reach us, but again, if you have any questions, circle back to us. Okay, so as far as releasing, when you leave, we give you a report. Okay, we give you a report of your surgery. Now, remember that these records are all in Spanish, except the ones that is given to you, and stays in the hospital in secure servers with MBC. Actually, not with MBC, with hospital. We don't have access to it. And because of the laws in Mexico, they cannot translate it. You can ask for a copy, but you cannot give you direct access. I hope that answers your question. Okay, so let's go back to we promised the raffle, and here's the raffle. Okay, so I have all the names, and I'm now going to look, and I'm going to pull one lucky. Let me see if I can. Okay, so wow, Kelly Gonzalez. Kelly Gonzalez, let's see if you can have you talk to us actually. Kelly Gonzalez. Let me see here. Yep. Kelly, I'm gonna allow you to talk. Please unmute yourself and talk to us about yourself, where you live, how are you doing? Hello, hi, congratulations. Kelly, do you hear me? I see you are unmuted, but I don't.
Can you hear
There
me
you
now?
go. Hi, how are you?
Doing good. How are you?
Great, great. So where do you live?
I live in southern Indiana.
Wow, nice. Thank you for joining us and congratulations.
Well, thank you so much. I really appreciate it.
Sure. So tell us about yourself.
I'm a mother of two here in southern Indiana, and I've always been overweight my entire life. I've struggled before. I've lost 100 pounds after high school. With my pregnancy, I gained it back, and I've just been up and down ever since then. So I think weight loss surgery will be the best bet for me to hopefully keep it and maintain it off. So I've been
Yes.
with you guys for a while. I've had my niece who went to you guys and has a really successful story herself with losing her weight and maintaining it as well.
Awesome to hear that. Okay, well, we will be in contact with you to get you on the calendar and hope to see you down in the new hospital. Everybody was so excited to be in the new hospital and they loved it. So hope to see you down there. Okay.
Thank you, Ron.
Well,
Thank you so
thank you,
much.
Kelly, and thank you everyone else. Again, I apologize for Dr. Osuna not to make it. Well, we will have another one next month. We will have different ones in the revision. Look up for upcoming webinars and hopefully seminars. Okay. Thank you so much, guys, and have a good day.